সবাইকে আমন্ত্রণ জানিয়ে শুরু করছি চ্যানেল 24 এর নিয়মিত আয়োজন মুখোমুখি অনুষ্ঠান। আপনাদের সাথে আছি আমি আশাকিন প্রিন্স। আজকে আমাদের মুখোমুখি হয়েছেন যুক্তরাষ্ট্রের সেন্টার্স ফর ডিজিজ কন্ট্রোল অ্যান্ড প্রিভেনশনের বাংলাদেশ কান্ট্রি অফিসের কান্ট্রি ডিরেক্টর ডক্টর নেইলি কেদোস ড্যানিয়েলস। Dr. Neili, welcome to our show.
Thank you so much for having me here today.
Thank you. So first of all, I want to know from you that what is the function of CDC in Bangladesh?
So CDC has been working in Bangladesh for 50 years. We have really two main types of activities. First, American CDC scientists work with Bangladeshi scientists on research studies. And these research studies generate information that is used and benefits not only the Bangladeshi people, but also people in other countries. So for example, CDC is working with ICDDRB on studies on how to use the polio vaccine better. And so they're answering questions like, at what age is it best to give polio vaccine, and how much time should there ideally be between doses of polio vaccine? The results from these studies will actually be used in other countries to help stop polio outbreaks. The second kind of work that we do in Bangladesh is that we support the government of Bangladesh institutions to be stronger in public health. We really want to make sure that we protect Bangladeshis, but also the rest of the world. And so in public health, we want to be able to prevent the next epidemic. For example, working with IDCR, we work with them very closely, and we worked very closely on COVID-19 pandemic to support IDCR in terms of, for example, expanding testing and making testing better, and to find cases and do contact tracing so that we could know that more people had infection and get them out of circulating with other people.
Why Bangladesh is important for CDC?
Oh, Bangladesh has been a very important country partner with CDC truly for the last 50 years. For example, in 2015, the United States government identified Bangladesh as a phase 1 priority country for the global health security agenda. This is a group of 70 countries who all work together to try to strengthen their own countries on the ability to prevent pandemics, to detect outbreaks when they happened, and to respond quickly. You've probably heard it's been said many times during the pandemic that none of us is safe until all of us are safe. And that really refers to the fact that infectious diseases don't respect national borders. As we've seen with COVID, borders don't really mean much. And so it's very, very important that we strengthen those public health institutions in all countries really to try to keep us all safe.
You have already mentioned the next pandemics. Which types of pandemic or which pandemic will come in next or in future?
Well, I can't predict pandemics. I wouldn't try to. First, I will say that the COVID pandemic is not over. We seem to be coming out of it, which is good, but we have to remain vigilant and continue to do disease surveillance and look for that next variant that may cause more severe disease. We hope it doesn't come, but we really don't know. But one thing that we are also dealing with right now, as I'm sure people have heard, is the monkeypox pandemic. So just because we have one pandemic happening doesn't mean that we won't have another one happening. To date, there have been over 44,000 cases of monkeypox in nearly 90 countries where monkeypox isn't normally found. Just another indication that diseases spread and that we really need to all strengthen our country's systems so that we can try to prevent spread to other people.
Monkeypox is really a threat for in subcontinent or for Bangladesh?
So there have been monkeypox cases on the subcontinent, but I'm hoping that it's not a threat to Bangladesh. I mean, there is surveillance. We're looking for it. IDCR is able to test for monkeypox. It's not easy to find, but it's also not quite as easily spread as COVID. And so we remain, I think that my Bangladeshi colleagues would agree that we remain vigilant but hopeful. And I'm happy to report there have been planning meetings so that Bangladesh is prepared should there be cases here.
Antibiotic resistance would be or maybe the next pandemic for mankind?
I would say that antibiotic resistance is a pandemic that's already happening. We have to be extremely careful, all of us, everywhere around the world, in how we use antibiotics. This is a pandemic where the more that we use antibiotics, the more drug resistance there will be. And eventually we will get to the place where we can't treat infections with antibiotics anymore. And it's actually already happening. There are already cases of people who have an infection that used to be easily treatable with antibiotics, but now is completely untreatable, and in some cases they're fatal infections. In Bangladesh, there's quite a lot of antibiotic use. Antibiotics are widely available without a prescription, and even when there are prescriptions written by a doctor, many times it's either more antibiotics than are needed, or it's unnecessary for various reasons. Antibiotics are also used very heavily in food animals. Mm-hmm. And so all of this antimicrobial use is actually increasing the amount of resistant organisms there are here. And so Bangladesh does have policies and regulations about regulating the use of antibiotics, but policies alone aren't enough. We need to have good, strong policies and guidance. They need to be kept updated, and they need to be enforced is really important. CDC is actually supporting projects with ICDDRB and IEDCR to conduct surveillance and studies to combat the antimicrobial resistance rise here in Bangladesh.
Would you think these policies and regulations are properly implemented in Bangladesh?
So CDC's area of focus is not so much on whether or not the policies are implemented well, but there are policies, and we have done some research projects that have shown that there is still quite a bit of antibiotic use that's without a prescription, and we're doing studies actually with some of our partners here to better understand if the policies and the guidance for antibiotic use are, if they're being followed and if they're in line with what's really necessary here.
What is your observation about the Bangladesh health service?
So I think it's really wonderful that that Bangladesh is making healthcare available to more people. The focus, the area of real focus and expertise, the mission of CDC is more focused on prevention of illness than on treating patients. But there are opportunities for prevention within the healthcare system too. So for example, I do understand and have seen that many of the public hospitals are very overcrowded. Many patients are trying to be seen, and frequently they seem to be understaffed in my experience. And so that creates conditions where it's very easy for infections to spread between patients, among the patients and their family members who are in the hospital with them, among the staff. And so it's really important that when someone go to the hospital for an illness or for surgery, that they not be infected with a new disease while they're in the hospital. And so it's important that there are systems to protect and to prevent infections and to control them in the hospitals. And so some of those types of interventions are just having soap and water available for hand washing, good ventilation, and ensuring that patients who have infections are kept in different areas than people who don't have infections.
What is your observation about immunization system in Bangladesh?
So immunization, I think childhood immunization in Bangladesh is really a success story. It's really a model even for other countries. Rates are high, there are strong programs, and what we're seeing, and it's important to not rest on what's the successes of the past. Important to continue to support those programs and to continue them to be strong. What we're seeing in other countries is we're seeing diseases that have been eliminated, particularly polio and measles, they're coming back. They're coming back and they're affecting people, and it's because immunization rates have dropped. And so it's very important for Bangladesh to maintain those really strong immunization rates. Bangladesh is also a huge success story for COVID-19 vaccine. The U.S. government, through my colleagues at USAID and through the COVAX program, have donated more than 85 million doses of COVID vaccine to Bangladesh. And Bangladesh now boasts one of the highest vaccine rates among many countries. It's over 71% fully vaccinated. I believe 35% or more that are boosted too. And vaccines work. What we've seen during COVID in Bangladesh is that as vaccine rates increased, the subsequent waves of COVID caused fewer deaths. They caused fewer hospitalizations and really less disruption, for most of us, less disruption to our daily lives, which is what we're hoping for. Now, as I did say, we do have to remain vigilant and with our surveillance and make sure that the vaccines that we're using continue to be protective against the strains of the virus that are circulating. But all of this, it's really impressive what Bangladesh has done in terms of immunization programs.
In terms of dengue, every year dengue is spread out in Bangladesh. The reason is only climate change or a regional situation in Bangladesh?
So the question of dengue in Bangladesh is interesting, and it is very tied to the weather. So there are many diseases, many infectious diseases that have a natural yearly cycle. Many times it's connected to the weather. And so to understand that in Bangladesh, it really comes down to the mosquitoes, the Aedes mosquitoes that carry the dengue virus. And these mosquitoes only need just a few milliliters of water to breed. And so they can breed in, and they love small containers, a flower pot that's holding water, or a discarded, like a half of a coconut shell, or any little piece of trash, wrapper, that has a little depression where that water can sit. And so the mosquitoes lay their eggs, and then when it rains, those eggs are submerged, and then the mosquitoes hatch and grow and become big mosquitoes. And so you can get dengue in Bangladesh at any time of year. The mosquitoes are always present. But with the monsoon season and the rains, a single container can refill multiple times, and it can support generations of mosquitoes hatching. And the other important part of that is that you tend to find more dengue in cities, because cities have lots of little containers, and they have lots of people, which the mosquitoes love to bite, as we all know. And so a lot of the cases end up in the cities. And so what CDC is doing is actually supporting projects in surveillance with IEDCR and with the city corporations to improve the dengue surveillance in the city corporations, so that those city corporation authorities are better able and more quickly able to put mosquito control efforts where they're needed much more quickly than they might be able to otherwise.
In future, which sector CDC can support Bangladesh government?
So CDC really works in public health. In Bangladesh, that's multiple institutions. Right now, our major partner is IEDCR, but we do work with other parts of the government. Particularly, we work with Department of Livestock Services on training veterinary epidemiologists and conducting surveillance and vaccines for livestock. We work with the Bangladesh Livestock Research Institute, Bangladesh's CDC, Communicable Disease Control Division, and then others. So we're hoping to expand. Bangladesh is important, and my understanding is that we will be having more resources in the future, so that we can better coordinate with our Bangladeshi colleagues.
Dr. Nelly, we will conclude this program now. So, thank you so much. Stay with us. Hope in near future we will talk with you again.
Thank you so much for your time. It's been a pleasure.
Thank you. দর্শক, শেষ করছি মুখোমুখি অনুষ্ঠান। আশা করি দেখা হবে পরবর্তীতে অন্য কোনো অতিথির সাথে।